Okay, so um, the difference between dermatomal, peripheral, and regional sensory loss is that dermatomal usually involves the whole nerve root at the spinal level. The peripheral is when a lesion is suspected not in the central nervous system, but at the periphery, so PNS, so away from the central nervous system, and it's a single nerve. Regional, a regional deficit would be when something happens at the cortical level, like a stroke or something like that. Okay, I don't have anybody to demonstrate, so I'm going to try to explain it as best as possible. So, in terms of the light touch sensory exam of the lower extremity, you would first instruct the patient on what you're going to do, which is, you're going to lightly touch certain areas of their body, asking for permission, of course. And you would tell them what kind of responses you would want. So in this case, if they feel it, you would want them to say yes. You would then position the patient appropriately. I think for the lower extremity, for them to be laying down is the best position. And for this one, we want to make sure not to stabilize at all, or else they're going to register the stabilizing touch as opposed to the light touch that we're trying to test. And then when we go into performing the actual test, we first want to ask the patient to close their eyes. And we're going to lightly touch the designated area a few times to see if they feel it or not. And I'll go into which areas in a bit. We want to make sure not to dent the skin. It's supposed to be kind of a light, not even a stroke, but just like a light touch, not indenting it. Okay. And yeah, if you want to test it like at least a few times, 5 times is what Physio U told us to do. And yeah, if they feel it 5 times, everything is fine. 3 to 4 times, it's, what is it called? It's impaired, and less than 3 times, it's absent, the sensation. Okay, so the areas to be tested with light touch are L1, which is the anterior groin, L2, which is the middle to upper anterior thigh, L3, which is the middle to lower medial thigh, L4, which is the medial aspect of the foot to the great toe, L5, which is the central dorsum of the foot to middle toe, S1, which is the lateral aspect of foot and ankle, and S2, which is the middle of the posterior thigh. Okay, so that's for lower extremity and light touch test. For the proprioception exam, it's a little bit different because one, we do have a stabilizing hand, and I'll get to that in a bit. But again, same procedure. We're going to instruct the patient on what we're going to do. We're going to ask for permission, and we're going to instruct with their eyes open. We're going to instruct what up and down means. So for the thumb, let's say, it'd be like this. You would stabilize right here on the metacarpophalangeal, and then you would move it up or down, just so they know what up or down means before you initiate the test. Okay. Then we would position the patient appropriately. With this one, it could be either laying on their back or sitting down. And we want to work distally to proximally in this test. Okay, so in order to do the test, once again, we have them laying down. For the upper extremity specifically, we're going to be testing from the fingers all the way to the shoulder. We're going to ask the patient to close their eyes, and then we're going to start with the thumb. So the thumb, like I said, we're going to stabilize at the metacarpophalangeal joint, and we're going to move up or down 5 times randomly, randomly timed and randomly, not just up, down, but up, down, up kind of thing. And once again, if they feel 5 out of 5, if they get 5 out of 5 of the answers correct, everything is good. If they get 3 to 4, they're impaired. If they get less than 3, the proprioception is absent at that location. Once we're done with the thumb, then we're going to move over to the wrist, in which case we will stabilize at the distal radial and ulnar styloid processes, and we're going to move their wrist up and down in this fashion 5 times. Once we're done with that, we're going to move to the elbow. We're going to stabilize at the kind of like the distal humerus, and we're going to move their elbow up or down 5 times. And then lastly, we're going to move their whole forearm and arm up and down to test the shoulder proprioception 5 times as well. And that's for upper. Thank you.